It was a busy day in my pediatric clinic. Just when I was about to sign off to grab some lunch, a 5-year-old boy named Ravi walked in with his visibly worried parents, Mr. and Mrs. Sharma. I immediately noticed Ravi's lurching gait. He was dipping somewhat on one side and moving slowly. Before I could ask anything, the Sharma said that Ravi had developed some brown patches on his chest and back. Clearly, there was more to the case. I asked the Sharmas for any previous medical or family history. None. I examined Ravi physically. Many irregular shaped coffee-colored macules on the left side of his chest and back, but not crossing the midline. Classic cafe au lait macules. Gosh, that term always makes me want coffee. Nevertheless, I made Ravi walk. It was clearly a Trendelenburg gait, since his pelvis on the non-weight-bearing side was tilting downwards instead of upwards, so a sign of weak hip abductors. After a thorough examination, various possible diagnoses popped in my mind. Tuberous sclerosis, Legus syndrome, neurofibromatosis, and McCune-Albright syndrome were on the top of my list. I ruled out neurofibromatosis instantly as there were no visible neurofibromas or axillary freckling and the pigmentation was irregular, not smooth like it is in neurofibromas. Legus syndrome was unlikely since there was no family history and the patches were irregular. None of the diagnostic criteria of tuberous sclerosis were satisfied, leaving me with just one probable diagnosis of McCune-Albright syndrome or MAS. But classic MAS tends to at least present with 2 out of 3 signs. It's called the MAS triad. 1. Cafe au lait skin pigmentation. That's a check for Ravi. 2. Autonomous endocrine hyperfunction, which usually presents as a precocious puberty or hyperthyroidism. Ravi displayed no signs of that, but I needed endocrine tests to be sure. 3. Polyostotic fibrous dysplasia, which is skeletal in nature. Ravi's Trendelenburg gait was suggestive of it, but I needed radiological confirmation. I ordered complete blood workup, including hemoglobin, CBC, random glucose, HbA1c, LFT, RFT, thyroid, and others with urine routine and microscopy tests. Instead of a CT or an MRI straight away, I suggested an X-ray imaging of the head, pelvis, and lower limbs, both AP and lateral views for all. Given my hunch and on some insistence by the Sharmas, I went ahead to request for a PCR test too. After a week, Ravi's parents came back with the reports that showed elevated random blood glucose, raised glycosylated hemoglobin, and increased levels of thyroid hormones, which indicated endocrinal involvement. There was also an increase in serum bilirubin and serum alkaline phosphatase, suggesting altered liver function and dysplasia in action. Calcium was borderline normal. And well, the limb X-ray showed multiple areas of mixed cortical density and ground glass radio-opacities, which was suggestive of polyostotic fibrous dysplasia. There was some frontal bossing and sclerotic patches at the bottom of the skull too. The clincher was the PCR result of active mutation of the GNAS1 gene. Well, that's McCune-Albright syndrome, confirmed. Such a rare condition that affects 1 in a lakh to million people worldwide. I explained the condition to Ravi's parents and how it was great to diagnose this early on. I reassured them of the skin patches being treatable but to be more watchful of his skeletal growth and endocrine health. I prescribed him a calcium vitamin D3 tablet once daily to ensure bone health. To manage hyperthyroidism, I advised carbimazole 5 mg tablet thrice daily. To manage his hyperglycemia, I gave metformin 500 mg twice daily. Since I needed to have Ravi go through periodic radiological and endocrine checks, I scheduled frequent follow-ups for him and explained to the Sharmas how important it was to comply but not to worry. An interesting fact is that the cafe au lait macules in the neurofibromas are smooth-edged in neurofibromatosis like the coast of California, whereas in MAS they are jagged or irregular like the coast of Maine. I can mark this one in my clinical memoirs. If you'd like to read more on the condition, please click on the link in the note. I'll get myself some coffee.